We are we want to keep the schedule, but we are not very keeping the schedule. That means that it can be delayed, or whenever you have a question, it's everybody have the right to make a question. So. My first talk is on anatomy. As you know, the anatomy is just anatomy. But I think I would like to show some old picture of my early age, which is 1983. I wrote a thesis. My master's degree paper was on conduction system of heart in 1983. That is before I joined cardiologists to work together. So I was just lucky to have this occasion to think about what is conduction system and what's the anatomy and what's the history and what's physiology of conduction system in 1983. So I had an interesting autopsy case of arrhythmia, but the patient was tuberculous pericarditis. So it was just the core, it may be co-association, but it struck me I should start the conduction system in detail in 1983 and publish a paper. And then at that time, to make a good picture of the specimen is very important task for me. So I used this kind of device to expose the heart of what I want to show. It was very much time consuming, but it is very important for us to show a nice picture. And then when I visit London and Japan, I could see a very interesting device like this, which is much easier to, it's a kind of retractor of a specimen to expose more. And then additionally, the polarizing filter was used to make a better picture and so on. And then very recently, I could see in Facebook message from Japanese people making this kind of device with plastic filter paper, and to make incubate to develop embryo and chick embryo. It was a very interesting concept that before that, Professor Yu Shijun, his PhD paper is in vitro culture of chick embryo and manipulating the heart and developing outflow tract malformation was Professor Yu's thesis paper. At that time, we thought we can just open it and make some manipulation of the heart to make a congenital heart defect. But now we can see in this kind of device is developed in Japan, and it is published in paper in 2014, 2 years ago. So it was there is a very funny concept to totally make a new paradigm in making in vitro culture of chick embryo, and it was very successful to make a chick and so on. And then it was the in vitro culture of mammalian embryo is additional part of the development of cardiac embryology, and this is in vitro culture of a mouse embryo. It is a human embryo taken during cesarean, not ectopic pregnancy, salpingo pregnancy specimen pathologists can take. So this kind of human specimen taken due to ectopic pregnancy of human has been used for cardiac development of human. It is a candidate for morphological study for a long time, and also scanning electron micrograph of this kind of specimen was very well studied by Viraha in Czechoslovakia and his group. And this is my picture taken from mouse embryo and sectioned after cryosectioning and so on. And then the immunohistochemistry contributed a lot on the development of materials in human embryo, so that we finally could follow the development of conduction system of human embryo, so that it changed a lot on embryonic developmental concept of human heart, and also development of conduction system of human heart. And then returning to my original study on conduction system, I could continue studying conduction system, because the ablation of arrhythmia cases technology has been developed, and my original study was rolled back to study more about anatomy and location and conduction system and so on. So by making intentional sectioning of hearts, and we could follow which is conduction system, where they go, and sometimes I could find the lesion in conduction system that can be possibly the origin of conduction system. And also we could see the junction between atrial myocardium and ventricular myocardium, so that we could easily find the very intimate connection between atrial myocardium and ventricular myocardium without any significant aberrant conduction. That means the immediate attachment is not the reason for the aberrant conduction, but there is some additional inflammatory condition contributing this kind of situation. So it is not a congenital anomaly, but it's an inflammatory process to develop such aberrant conduction. Returning to the anatomy, it's very simple, and I'm sure everybody, you are very much familiar with most of the anatomical principles. So I just want to see, but and then the internal anatomy is like this, and like this, and like this. As you can see, this is picture taken with Professor Yu Shijun, was that we could make a light behind this specimen to show the membranous septum and thin anterior reflective mitral valve and so on. And then sectional anatomy was important for echocardiographer and so on. And coronary anatomy is also important. And dissection anatomy for surgical anatomy for Waterston groove, and the internal anatomy after exposing the Waterston groove is an additional services for surgeons to show what this look like with a full exposure of heart specimen. And this is for aortic valve exposure and atrial exposure to show how membranous septum is visible through atriotomy. And also the dissection of muscle direction of human heart has been started a lot in Japan a long time ago, and it was very we could use some specimen to realize there is some different interlacing directions of heart specimen, which may have important for understanding. Moreover, I think it's very important to realize the heart is not a single heart. It is within the heart environment. That means there are lung, liver, thymus, and mediastinal structure, and so on. So the relation between these structures are very important to understand. And also the pericardial anatomy after removal of the heart is also very important to show, particularly important because when we understand the autonomic nervous system and ganglionic plexus system, it is important how the heart is attached to the mediastinum. So this picture is really just reminiscent this picture. So the location of the major ganglionic plexus is just the location of heart attached to the mediastinum in pericardium. So this kind of thinking is, I think I found it's similar to topographical research. That means if you think about the shape of the mountain and river, we realize this is a good place and this is bad place. It's a old traditional way of thinking how the ki and chi is going from the heaven to show in this area. So this is a kingdom where king should live and so on. So this kind of topographical study is a kind of interesting thing. The similar approach has been already started by a lot by segmental systemic approaches congenital heart disease. Maria de la Cruz in 1960 and Richard Van Fra and Anderson studied on how we can approach in segmental or sequential manner to the heart anomaly. Basically, this approach has been deducted from the anomalies we could find, but still we can think about this concept and we can imagine how we can treat and how we can diagnose and how conduction system will develop in this kind of abnormal specimen. As you know, corrective transposition conduction system is one of the key historical events to understand human heart conduction system. That's also related to embryology concept. And also segmental sequential analysis is important for understanding heart disease. And then nowadays we think it's important to educate medical students so that we should train them as a good cardiologist, candidate for good cardiologist and cardiac surgeon. So, but there's a limitation of heart specimens. So what I'm doing now is that make a video clip of, give the video clip to students. And so, for example, if this is a video clip for students and they are watching and listening this video clip, and then I'm asking them to make a PowerPoint presentation after making a stop, like you do echocardiography, make a stop images to make a report. So I'm asking students to make stop images of this video clip, and the students hearing and studying video clip and making PowerPoint presentation like this, so that they understand the details of anatomy through virtual specimen, and then this is their report. So what is membranous septum? These pictures are taken through the video clip that I supplied. So this kind of educational program could have students to understand heart as an active and moving structure rather than a static or static structure. So I'm summarizing this meeting. It's a kind of inter meeting. What is inter? It's an interventional meeting, and it's an international meeting, and interactive meeting. But the most importantly, what do you think inter, any other inter you think? Do you have any idea? Yeah, you have. You may have, but I conclude like it should be interesting meeting. Thank you.